Obesity is a chronic disease that can affect people at any age and should be recognized as something that can be prevented and managed across the lifespan. The approach to management can vary depending on whether an individual presents at a very young age, such as child or adolescent, in adulthood, or as an older adult. Obesity can impact many systems of the body, and its complications such as hypertension, type 2 diabetes, are increasingly being diagnosed at younger ages. Over the past 3 decades, obesity rates have risen exponentially across all age groups. How do we then manage obesity across the lifespan? Well, the first step is to have a solid understanding of obesity as a chronic, multifactorial disease. We also should take the time to reevaluate our potential biases regarding obesity and its management. And this can help us foster a space where we can engage individuals or families in potentially sensitive conversations about weight. In early life, obesity management should emphasize family engagement in both preventative and in active medical management. Effectively managing obesity in children and adolescents requires family communication, dynamics, and routines. So discussions around nutrition and behavioral interventions must consider the family unit. In addition to nutritional and behavioral strategies, this age group also has access to pharmacotherapy and surgical options. Familiarity with the local pediatric obesity programs and clinical practice guidelines is important for effective management and can provide our patients and their families with valuable options to consider. In midlife or adulthood, obesity can present as a disease on its own or in conjunction with other complications and chronic disease. The approach to management needs to be multimodal and individually tailored and sustainable. Factors such as increased stress, sleep disorders, emotional and physical trauma, and many others can significantly influence the presentation of the disease and its severity. It's also important to understand the resources available to your patients in the area, including obesity medicine specialists and bariatric surgical centers. When addressing obesity in older adults, the conversation shifts slightly. Many individuals in this age group may have concurrent chronic conditions that can also benefit from effective weight management. But it is important to balance the benefits of weight reduction with potential harms. The discussion should consider the risk of losing lean muscle mass versus visceral fat mass, particularly in the light of conditions such as sarcopenia and associated risks of fracture. Management strategies may aim for gradual weight reduction or even establishing weight stability. The primary goals in this age group are to maintain or improve health, to enhance quality of life, and support the maintenance of lean muscle mass for improved mobility and strength. No matter the age group, familiarity with the clinical practice guidelines and an understanding of the resources available in your area are important to help guide people to effective management options.